Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Carrie Reller, and today we have Dr. Umara Salim. Did I do it right? Salim.
Saleem.
Okay.
Yeah.
Yes. Okay. So why don't you tell us a little bit about who you are and what you do first, and then we'll dive in.
Yeah, no worries. Hi, Carrie. Hi, everyone. My name is Dr. Umar Salim. I'm a board certified family medicine physician, originally born in Pakistan, raised in New York City, and I've been in Tampa for almost 3 years now. I just opened my own office just a few months ago, Gravity Health, FL.com, basically Gravity Health. And it's family medicine office. We're also doing Botox as of this year, fillers, and focusing on medical weight loss. And I always tell my patients that, the best part of it is the practice, which is shared between my husband and I. And he's also a board certified family medicine physician as well as a hospitalist. We love really getting to know the family. It's one of those traditional old mom and pop shops where we like to take care of the whole family. We get to know you and get to take care of grandparents, the kids. We are doing patients really above 6 because we don't have the vaccines in house yet, and catering to the patient as well with if they're interested in weight loss, and it's going to be physician guided and doing like some life improvement stuff. So it's like feeling well from the inside to the out. So make sure everything is going great on the inside, looking at your lifestyle and kind of like helping you achieve the maximum optimal life that you can. And we'll be here to support you with that.
I love that. That's a great way to, being able to practice and take care of everybody. That's really neat that also you're truly a family doctor with treating patients with your husband, which is super exciting too. I don't know how he would balance hospitalist and that, but that's very impressive.
Yes.
But
Well,
congrats to you.
yeah, it's sort of almost kind of moving into concierge, like DPC
Mhm.
medicine as well. I've been doing charity work for, my entire life and working in nonprofits as well. And him also. So if there's patients that specifically want to see a male doctor, we can
Mhm.
accommodate that. Because I have patients I've been seeing for years and certain issues they only want to discuss with a male doctor. So we have my husband
Yeah.
for that. And he has women that, he's seeing and they want to get their pap smears with me. So I do women's health, so I'm happy to accommodate them. So we really kind of together make a team that can help the patient and their family in any way that they want.
That's awesome. I love it. Is it concierge or are you taking insurance? Which one?
Yes, so right now I'm in the panel with just a few insurances, Aetna,
Okay.
United Healthcare, Cigna, and straight Medicare and Medicaid. And I also do self-pay and moving also to allow concierge medicine where, a patient can schedule, we can go to their home. We can meet up
Mhm.
at yesterday, my husband went to see a student at school. The mother had called us. She's like, oh, after school, can you meet us there? And he's like, okay. And, we're really very flexible since it's our own practice to really help accommodate people. Since, everyone is busy, busy moms. There's this homeschooling like mom that I see, I'm able to go see her at her home because that's just 4 kids she's taking care of. So, or she can come close by. So really want to be very accommodating with how the world is working now.
Yeah, absolutely. Yes. And hopefully they don't get rid of our telemedicine. That would help people too. But okay, so you are going to teach me a lot today about the benefits and significance of Ramadan and fasting, and I'd love to hear your personal and professional perspective on it as well. So why don't you tell us a little bit about, what is the significance of fasting in Ramadan from a holistic perspective?
Yeah, so Ramadan's like a very special month for Muslims all over the world. We follow the lunar calendar of Muslim as well. And so it kind of changes every year. This time it's hitting at a great time. It's not in like those long days in June and July where the sunlight hours are a lot. And then some years we get lucky where it's in like December and November. So the sunlight hours are short. But it's a very beautiful time for Muslims. Kind of a lot of them look forward to it all year. We believe so many special things happen in that month. And it's just a really great like spiritual awakening. And one of the ways that we celebrate that is by fasting, which is something that is required in the Muslim religion. It's like one of our 5 pillars. And so it's basically fasting during the daylight hours. Intermittent fasting is super popular, as you know. But into intermittent fasting, people can do liquids. Here, during the daylight hours, so basically sunrise to sunset, there's actually no oral intake through liquid or solid. So not even actually even medicine. So a lot of patients that are taking oral medicine, they have to take their medicine before sunrise. And so as you can see, it really plays a big part in how the care translates to the patient. And some people And certain type of injectable things are not okay as well. Like if it's really going to be impacting like metabolism, that might not be okay. For example, you can't get really IV fluids. It will break your fast since you're kind of hydrating the body in that
Mhm.
time period. And people that are on insulin. So, and there's a lot of exceptions in regards to patients as well that are Muslim. So, for example, women that are nursing, women that are pregnant, elderly, patients that need to take medicine during those daylight hours, and it's going to be, against their health to fast, they're excused. So a lot of people are excused from fasting, but a lot of other patients get really creative. So, and it helps to know as a doctor what they can and can't do during those times so that you can structure their medicine a little bit better. So, example, patients are on blood pressure medicine, twice a day or like 3 times a day. If there are certain medicines 3 times a day, like a patient propranolol 3 times a day, we kind of accommodate her for that month. So we're trying to make her medications like before and after sunset. And also, certain medicines, they have to be taken with food. So if the patient's not going to be able to eat during the day, then you try to become creative with, okay, we're going to do this like beginning of the day and then take it with your morning, and after you break your fast you can have it with your dinner, and making adjustments as well during the month. So a lot of times I've seen patients, they improve in so many things regarding their health. You learn self-control, you cut out a lot of some of those habits that you're doing during the day, like if you're having coffee 10 times a day for that caffeine. You can't have that. So it changes, it's a lifestyle change. As we all know from research, it takes time to implement a new routine lifestyle. So Ramadan is like a really great way to reset the human body. And I can talk a little bit more about how that affects internally as well. But overall, they're following a new routine for the month. And in the daytime hours when you're not eating, and there's other things you can't really do as well, like you're not smoking, you can't have intercourse. So you're really just abstaining from certain things like that, and focusing more on like spiritual awareness, doing more like recitation of the Quran. So it's more of like introspection and recitation. So you're making more habits for sort of like mental wellness. That way that I see it, you're praying more. So there's an act of like washing up before prayer, and you're sitting and you're reciting verses from the Quran in Arabic. So it's sort of like, beautiful conditioning for your mind where you're calming yourself, you're taking time, and whatever you do on your daily basis, like if your life is centered around getting your lunch and picking up your coffee, you kind of put it aside and look at, okay, what do I really need to think about? What is my lifestyle like? What are some of those addictive behaviors that I have? And incorporating that into both a spiritual and a physical perspective.
Mhm. I mean, what is interesting is I'm hearing that you're actually doing patient management. Like you keep mentioning, like my patient, you can adjust their medicine. So this is, wonderful that you can work with actual patients and helping them manage their medications, lifestyle, chronic disease, whatever it is, to, adjust for this time period that they are focusing on. So that's super interesting.
Yes. And, we have to deal with certain cultures as well. And I think one
Mhm.
of the best things I love about my own self is not only I wasn't born here, but I mean, it came when I was 4 years old. I feel like I'm more American than everyone else I know. And learning about different cultures, and I got to learn that in New York City, where you get to really know different cultures and practices and religions. And even with Islam itself, there's a lot of different like countries that are Muslim, and each country has their own practices and cultures. Like my family's from South Asia, from Pakistan, and for the most part, a lot of women are fasting in Muslim cultures during the pregnancy. And that's something we really talk about. And a lot of women ask during Ramadan is, I'm pregnant, should I be fasting? Sometimes I feel like they feel like either a cultural pressure or a spiritual like obligation to, but we have that conversation. Well, what's going to happen when you're fasting? So you're not having food and water during the day. You're going to be tired. You're going to be dehydrated. You're going to have more cramping. So, is that going to put you at risk? Are you going to be losing weight? Are you getting adequate nutrition? So we have that conversation with them. So,
Mhm. Go into early labor too. Yeah. What you mentioned 5 pillars. Could you tell me what the 5 pillars are?
so for all Muslims, we believe we have like 5 things that we sort of have to, sort of mandatory to do. The first one's just like the belief in Islam, which is saying like La ilaha illallah Muhammadur Rasulullah. So that basically saying there's only one God, there's no God but Allah, and Muhammad, peace be upon him, is a prophet, since we believe he's like the last prophet. And we follow the prophets that had come beforehand. So like Jesus and Moses,
Mhm.
Abraham. So we share a lot of the prophets with the monotheistic faiths like Judaism and Christianity, but we believe Muhammad's the last prophet. Then it's Salah, which is another word for prayer. So we pray 5 times a day, which having gone through many things in my own life, just medically and personally, and having a focus more on mental health as a physician, as a family doctor, I love that. And I've been practicing that for years. The 5 prayers that Muslims have, it takes just a few minutes. You wash up a little bit beforehand and you go on the prayer mat. So you kind of pull away from work. You go to a quiet area, you sit, there's like a physical movement and there's some oral recitation that you do in Arabic. So it's sort of like almost like centering and grounding yourself. And some of the movements, like the way that you're performing and the positions, really do kind of put that focus and have you kind of step away from whatever you're happening. So I remember, like, for example, in residency, with so much going on in the ER, it's easy to get overwhelmed and lost. You're like, okay, I can like just take a 5 minute break, step away, refocus, and come back. So then the third pillar is like Sawam. So that's fasting. So that's fasting during the month of Ramadan, which is a great thing for everyone that can do it if they're physically able to. And it kind of helps reset your body, which we'll talk about. And I'll give you examples of that. Then fourth is zakat, which is giving charity. So required for Muslims, it's like 2.5% of your income or savings that you have. Like if you have gold in savings, for only those people that are able to, they have to calculate that and give it. And a lot of people like to do that in Ramadan because it's a holy month and we believe you get so many more times of reward than any times of the year. And the last one is the Hajj, which is the annual, it's like a pilgrimage that happens once a year in a special month of Hajj on the Islamic calendar. And that's for people that can afford it. They go and they perform that journey in Mecca, in Saudi Arabia, where they're following a lot of the traditions of the prophets that had come beforehand, like Prophet Abraham, and doing some of the same steps that we believe the prophets had done before. So those are sort of the 5 like pillars that kind of really make Islam Islam. Otherwise, like I think a huge part of Islam is just having really beautiful character. So Islam is sort of a religion that incorporates lifestyle changes as well as like with creed and beliefs. So, like you have a very clean, conscientious lifestyle, which I always tell, like sometimes, patients want to ask me about that, like, oh, you're covering your hair, or you're not, that's just you don't smoke, you don't drink alcohol, you only really get married. You don't really do anything like dating, like, you do courtship to get towards marriage, but it's like a very conscious lesson. Like, well, we don't really do drugs or other things because you don't want to alter your senses. You always want to be in a conscious frame of mind, but you know what you're doing and what decisions you're making. And the beautiful thing about hijab is it really takes the focus off some of the external, that you're seeing somebody for who they are and the talents and the mind that they're bringing, and giving a sense of modesty and like protection for females. And I can attest to that, having gone to college at Barnard College, part of Columbia, New York City, and I was dorming there. And I started covering when I was in my early 20s. And I went from that lifestyle of where everyone's going to the bars and clubbing and like how important it was to look a certain way, to starting to like think about what do I want to do with my life and how do I want to live it? And maybe some of these things don't seem right to me, and trying to learn about, okay, more introspection, thinking about myself, and, taking the focus on some of the external stuff. Like instead of doing my hair for like 2-3 hours and coordinating my outfits, you can dress beautifully in a modest way. And then people kind of love you for who you are as a person.
I think that really helps, listeners who may not know as much about, Islam as, obviously you
Yeah.
or me, because I don't know much either, but I think that's really helps understand, where everything is coming from as well, and then you have this beautiful month of, prayer and fasting, and, it can have a lot of benefits to your body and your mind and everything. So why don't you tell us a little bit
Yeah.
about that?
So, like some things that are really beautiful about fasting, for one thing, it can really help regulate your quote bad cholesterol, for make it easy for patients. So, there's been a lot of studies that fasting can affect their lipid profile, and it can reduce like the LDL and in general the cholesterol. So, for patients that are higher risk for things like heart attack and stroke and diseases, in that month they find that and it's amazing because I see patients that are Muslim as well as like non-Muslim. And we do labs before. But I have some patients that had done labs right now, and Ramadan for us starts this weekend, like around Saturday. And after a month, we do the repeat labs, and literally just by fasting and not having really anything else that they're doing, like if they're taking their general medications, that's fine. And if the people that are not, like you really see a big difference, like the LDL will kind of come like a lot lower. Sometimes the HDL improves, but the overall cholesterol does decrease. And in itself, I'm like, look, guys, we could implement something like this during the year. And even like the appetite, another thing is because you're changing your lifestyle in those 30 days, as your, body gets used to eating less food. So, if you're fasting during the sunlight hours, you're not consuming food in those hours, there's studies that show like the stomach can shrink a little bit, so you can reduce your appetite after Ramadan. So you're not eating as much as you used to. And even having that sense of awareness and training for your body that, okay, what am I going to put in my body where if I'm not eating during the sunlight hours, I'm stocking up on my hydration and foods that will give me energy to sustain me throughout the day. So high protein foods and foods in high fiber, since you don't want to have constipation with the or dehydration. So you kind of like incorporate some of those healthy, good foods in your life, like things in omega-3 fatty acids. So you have sustained energy and, like the good healthy fats during the day. So you're not eating as much.
Mhm. Well, you
Um,
can eat at night, right? So you
yeah.
still want to be choosing healthy foods to eat in the evenings,
Yeah, and
obviously. Yeah.
and for example, if you have people that train now, there's like millions or
Mhm.
billions of Muslims around the world. There's like weight, training as well. So they're, really stocking up on that protein before and after. And then some people that, do exercise. Some people love exercise. They're doing their workouts in the morning or they're doing it in the evening. I do want to give you some more things about the fasting, just from like research. So we talked about like, digestive system, the stomach shrinking, and there's this thing with phagocytosis in the body where if you are fasting, your body is looking for things to burn off as fuel. So, okay, well, if there's things not coming through that door in that cell from the outside, your body's like, okay, what's in the cell that I can use? Oh, there's some proteins that need to be like denatured. Let me go work on those. And so it's like an internal cellular process of cleaning up the cell as well, which I think is
Mhm.
really beautiful and gets rid of some of that harmful things that eventually pile around and like, can affect like DNA. And back to like the stomach shrinking, like the fat deposition in your body decreases. So that helps overall for you, especially women that have hormonal issues like PCOS, and there's like an abnormal ratio of the hormones responding to fat. Women find that their cycles can be a little bit more regulated. So there have been some studies on that. And even mental status, you're sort of like supercharging your brain. So if the focus is not on, okay, where are we going for food? And you are taking that extra time. So if you think the amount of time we spend on eating and planning around eating and coordinating on that, if you're focusing on something else, which is like, okay, I can't do this. Let me, do this better at work, or I can spend more time on this. And you're using your brain more to like, if you are doing more prayers and recitation, there's mental health effects of reciting things and like, mantras. And for Muslims, that's the Quran. But in cardio, we talk about cardiovascular health, there's also inflammation. So there's research on inflammatory markers that are like decreasing in the body as well. And there's cellular repair that happens along with the autophagy that we talked about. And then there's some studies that like BDNF is sort of like boosted as well. And that can help with your memory. So that's brain derived neuropathic factor. So that can enhance your cognitive function. So that's boosted with the fasting and gut health as well. So like acid reflux is reduced during the day, which can help, overall for the body.
I think also like lots of patients with bloating and gas and things like that do pretty well with fasting to kind of also improve the gut health. And then you also mentioned, I think, insulin and the other hormones that can be improved and regulated with fasting. And then the mental clarity, I think, is definitely people see that, right? Especially when they are like when people switch over to a keto diet kind of thing, right? I think that they're, burning ketones for fuel rather than, carbohydrates. And a lot of people experience like the mental clarity. Are there any things that people do to prepare to do fasting or for those that are new to it? What would you say?
Now we have access to everything.
Yeah.
Society, there's like every new product in the market. But I know people like in the morning, they'll make sure they focus on the nutrition. So they'll have a protein and like complex carbohydrate meal in the what we call the sunnah, which is like the way of life of the Prophet, Muhammad, peace be upon him. He would start the morning with a glass of water and some dates. And we know dates of complex, carbohydrate, sugar, and they have fiber in them as well as like a lot of really important electrolytes and micronutrients. So that's something that they can kind of stock up on. So, people that are really into health. People do like electrolyte solutions, coconut water in the morning, and then during the day, they'll try to limit a lot of that training or physical activity more towards like the either they'll start off morning with it and then that energy will last them throughout the day or towards the night. So nothing in special for preparing. I think we go to
Mhm.
cultures, like cultures get really excited about this. And then, like I'm from Pakistan, they're making some of their amazing like little fried foods like pakoras and like they're making little biryani. So there's a really beautiful sense of community that is fostered during this month where people can get together in the morning at the mosque and, bring breakfast that they made at home to share with each other and like eat together. And then especially at night, the nights are very lively. Everyone's kind of flocking to the mosque. The mosques are super overcrowded at this time of the month. And people do a lot of potlucks where everyone brings some food because there's great reward in helping to break the fast of
Mhm.
somebody that's fasting. So this month for Muslims in Ramadan, they are racing to do as many good deeds as possible. So giving like extra charity, being extra nice, extra forgiving, like extra kind, like anything they can do that they think is a good thing, they want to stock up on. So, the highlight really is, I think, towards the evening where they're, doing these potlucks or giving. We're donating, like my husband, thankfully every year he does donate money to like different like mosques like in the US and abroad so that, there can be meals for everyone so we can get that reward. And then the nights are more focused on prayer as well. And the focus in the last 10 nights of Ramadan, there's like the holiest night, which they say it's on an odd night. So a lot of people stay up praying throughout that night, hoping to get that prayer on that night. It's called Laylatul Qadr, the night of power, which is equivalent to like 1,000 nights. So,
Mhm.
they're like, my good deeds are going to be multiplied that many times. So they're kind of really seeking a reward from God and even introspectively, like trying to be the best person they can be in regards to conscientiously being good, practicing, good manners. And that's like more on the behavioral level. So medically, we look, as doctors, the medical level. And I want to mention an important point is that, a lot of us doctors take care of patients that are athletes. Now they're in high school, students, or they're on sports teams. So how does that factor into when we need to consider when are they going to be doing practice? Do they need to have a little bit more break? Maybe, we could move them into an indoor stadium with air conditioning to do like accommodate them. And the last 10 nights, if you're staying up in prayer, maybe we could change the timing for the training, practice training. So it does incorporate into that. And because the people that are required to fast is anyone that has hit puberty. So, for women, when they start getting their periods, and for men, it's kind of around like 11, 12. So you're not really fasting until you hit puberty. But a lot of kids like do like mini little half fast beforehand just to participate or do something like cute like that in school. So there's a lot of kids that are fasting, right? They're kids, like they're teenage kids. So parents are very conscientious of, they got their fiber bar, their protein bar, the electrolyte solution. I hope they don't like, make it, go easy on them during training.
Yeah. My husband and I were talking before, and we were talking about a professional soccer player that he said in the past they've like stopped the game as soon as it got dusk and like allowed him to like drink and maybe have a snack or something. I don't know, but I thought it was pretty interesting. I don't know where or which one we're talking about, but he said he had heard that before.
Yes, like
Yeah.
especially in Tampa, there's a huge
Hmm.
Muslim community, there's a huge Arab community, and you see people everywhere wearing hijab or Islamic clothing, and
Hmm.
like that's one of the reasons why a lot of people move to Tampa. Like I grew up in New York City and they have like little micro communities, but here there's amazing like Muslim foods and Arabic foods. And like, despite what people may see on the media, I think the best thing to do is like really talk to somebody that's Muslim. So it's like
Hmm.
whatever you thought beforehand,
Yeah.
and change by just like talking to them. It's like, hey, maybe it's not what I keep seeing, or was being like controlled by social media or news.
Yeah, I know, right? Are there other lifestyle adjustments? I mean, I think you've mentioned a bunch already, like anything to adjust with the sleep, because I think with the praying and, the mindfulness that it incorporates, you're really having that mental clarity and stress management, right? I'm sure like the stress levels just drop during the month of Ramadan, right? But what about like, is sleep affected? Because now maybe people are staying up later and anything like that.
Yeah, I agree. So sleep is affected, and my kids go to Islamic school, and a lot of the Islamic schools they change their schedule. So they do abbreviated schedules. So they may start off later during the day and end a little bit earlier, so everyone can go home and focus on like finishing reading the Quran and getting mothers getting like meals ready or just sitting and doing a lot more of the worship. So yes, schedule is affected greatly, especially and then for kids that are not in, Islamic school, because like my kids were going to like public school before we moved down here, we would let the teachers know that, okay, maybe like, making up a name, like Jibril doesn't have to be in like the lunchroom at that time. It's Ramadan. Is it okay if he can spend like a lunch period in the library? So sort of thinking about our patients and accommodating them because, if they're sitting in lunchroom, everyone's having a meal, or, letting kids know, oh, it's a special time for, Adam. He's following something religiously. So we're not always going to be passing him candy bars or, if you're in a different school and bullying, like, oh, he's not eating, something's wrong with him, so you think about how it like translates to like psychology for kids. So I think having people aware that this time is important for families, and maybe Adam is staying up later at night and he may be a little bit more sleepier during the daytime. So just knowing what's happening in that person's life can help understand, and you can be more forgiving, and students can support him. And now I think Eid, which is the last, the day after Ramadan ends, like a big celebration for Muslims. So they're not going to be in school at that time. So knowing that, okay, kids are going to have to miss school. I know in New York, at least in New York, they've made it like on the calendar with Board of Education. I don't know if Florida's gotten there yet. But sort of understanding more life around kids, and especially work schedules too. So like, for example, when I was in residency, my husband and I would request like night shift during Ramadan. So we're working nights. So, we come back home, we're sleeping mostly during the day, and then we get to have our coffee, run around, see patients at night.
That would definitely make it a little bit easier, I would think. Yeah, for sure. To be working at night. Anything else that Ramadan or fasting benefits the person, patient, whatever you want to call it?
Yes, I would say like I think it's nice to say like, happy Ramadan to your patients, or you can ask them. But I know like some patients, like they're shy, they're very trusting of doctors. So, you can always like ask the patient, like if you see if they have like a Muslim like name, or like they look Muslim. So like, oh, I've heard, happy Ramadan is sorry for you. And then they're like,
Yeah.
"Oh, this doctor like cares and knows." So then they can be honest that they're not taking their insulin during the day, and they're not taking their medicine during the day, and like they may be shy to tell you, but they'll stop the medicine because they like, again, there's like the religious and the culture. So a lot of cultures really push everyone into fasting. Patients feel like a sort of like shame if they're not. So, have that conversation with my patients that are pregnant or nursing. It's like, hey, honestly, you don't have to tell anyone what's going on. And if someone asks, be like, yeah, Ramadan's going great. Because if you're prioritizing your own health, which is completely allowed in Islam, like we believe Allah wants like everyone to live their optimal, happy life and not like cause suffering. So it's the best thing about Islam. It's to some degree, it's flexible. Like there are things that are required to do to help in their lifestyle. But yeah, just being aware with a patient and talking to them about it. And then you can ask as a doctor, is there anything that, I can help you with the way you're taking your medicine, or questions about your health and how maybe fasting will affect you specifically? So, it's doctors that know some things about fasting, and knowing they're not having access to like food and water during the day, how's that going to affect your patient? So you can maybe like preemptively have that conversation with them and ask them, do you think Ramadan will affect your medication schedule, or how can I talk to you so that we can make it easier for you to get that medicine? Like, for example, I had these children when I was working in Connecticut a few 2, 3 years back, and I think they needed antibiotics. Everybody has strep in the house. So the mom is like, well, I'm not going to give it to them because they have to fast. And I was like, okay, why don't we, it's twice a day. I think it was like December. So, the daylight hours were like shorter. So, or longer. It was like, I think maybe it was like in the summer. I'm getting it reversed where, you're fasting so many hours. And she's like, well, I'm not going to be able to do it 12 hours exact because the fast was like 16 to 18 hours. I'm like, no, it's fine. Before they eat in the morning and right at like the iftar time. So when they break their fast, so sunset. And she's like, it's still okay for me and it'll still work. I'm like, yeah, do it that way. Or we can just do the daily dose of one big dose. So she really appreciated that. And she had the children take the medicine and they got better versus like, she kept bringing the kids in every few days. They were not getting better. They're getting sick and sick. And I'm like, you're not treating the strep here. We don't want to have all these issues later on in life, rheumatic heart disease or post-streptococcus pneumonitis. So, being aware of like what the patients are doing and if the children are fasting, and also having, a conversation like, I think as a doctor and having grown up in a culture that prioritizes fasting for women that are nursing and breastfeeding, I have that conversation with patients too with their kids. Like I think 2 years ago at the Islamic school, like the parents wanted like the 7, 6, 5-year-old to fast during the day. And like I had to have a conversation with the parent. It's like, hi, my daughter's in your class and I'm also a doctor. And like, look, if she's getting dizzy and passing out, like, I think we should give her water. And like,
Yeah.
just let her try because technically it's like when she hits puberty, it's required. So let's be a little generous. And most of the time, I think sometimes there's like cultural pressures. So we have a conversation about that and remind everyone, they have their own relationship with God, they have their own relationship with Allah, and you don't have to disclose what you're doing or not doing, but you try your best. And it's do no harm in Islam too. So do no harm as an actor, do no harm. So yeah, having that conversation with your patient, asking about them, seeing how you can make their life easier, and they will really love you and they'll open up to you. And I think it's so beautiful to like really learn about their culture and see them as a person, and it can really enrich your life, and you have more respect for the patients too, and vice versa.
Yeah, I mean, that's excellent advice for me and for anybody listening, I think, as well. So I really appreciate that. This has been a very enlightening conversation. I think that, like I said, I've learned so much as well. And things to take back to the clinic for sure. And I've had, some conversations on intermittent fasting and things
Yeah.
like that before, and it definitely can be very beneficial. So it's, essentially sort of a form of that as well. And it's just a little bit better, if you will, because it's bringing in that spiritual component. So like the mind body connection as well too, I think, which is really nice. How, if people wanted to find you or work with you, how can they reach out to you?
I'm relatively new in private practice. So, but I'm on, I think Google is Gravity Health in Brandon. I have an office in Brandon. I have an office in Temple Terrace, and I live in New Tampa area, Wesley Chapel. So I'm able to sort of like come meet them at where they are, like a concierge house visit type of thing, virtual as well. So they can find me through gravityhealthfl.com and or Dr. Umar Salim on Practice Fusion. And my office number is 813-521-6700, or they can email us right now. It's a Gmail while we're working on the IT. So gravityhealth01@gmail.com. But I love people. I love talking to people, and such a strong suit of mind to be able to like learn, as much as I can about the patient. That's something they can definitely expect from me. Is like, I really love to learn about them as a family and who they are and incorporate their health into their lifestyle. And I think they really see that, because when you work with patients, it's not like, okay, we're looking at the labs, we're following the labs, and then you don't develop that trust so they can or can't tell you whether or not they're following anything at home, or they're eating 10 cookies or butter or 5 gallons of soda at night, and or they're not taking their medicine because it gave them diarrhea or they had a panic attack and they're telling you that they are. So having that trust and letting them know you want to work with them and having that shared decision making is important with patients. And I definitely offer that, as well as like really get to know them as a person, and share things with them, and they feel comfortable asking me things, and just be very down to earth, very, very sweet as a doctor.
Yeah. I'm sure if that is the way you're going to be treating patients, which I think is a beautiful thing, I think you're going to have very success in your practice. So that's very good. So yeah,
Appreciate
we'll
it.
put all that information in the show notes. And I just wanted to, thank you for
Yeah.
coming on today, Dr. Salim, and
Yeah.
sharing your personal and professional experience with Ramadan with us. And I think it's been really nice. So thank you.
Thank you so
And
much. Bye, everyone, and happy Ramadan to everyone that's celebrating.
it says right, happy Ramadan. All
Yay.
right. Tune in next week for next week's episode.